Hi, my name is April Black, and thank you for joining me today to talk about smoking cessation. We're going to identify the CPT codes that you need to bill for cessation services. We're going to identify the elements of documentation that should be included and meet the CPT definition. We're going to identify the documentation elements that should be there for the diagnosis assignment. And I've put together a decision tree that can help that process for the coders, as it can be pretty tricky sometimes. And there's an example scenario that we're going to talk about together. Are you ready? So, first off, CPT codes 99406 and 99407. These are the two CPT codes. One is for 3 to 10 minutes of cessation counseling, and the other, 99407, is for 10 minutes or more. So these codes are time-based. The time must be documented. If it isn't documented, then you cannot bill for the service. Some of the other things that must be documented is the patient's willingness to quit is important. Other things that you really need to ask the patient is to qualify their smoking history. Is it a current status? Is it a historical? I did it one time, or I occasionally smoke in a social atmosphere, or I chain smoke every night. You need to know the documentation needs to reflect as much detail as possible. If the patient has a history of being exposed to toxins or secondhand smoke, that's important. If they've substituted products or failed other kinds of nicotine abstinent products and in the past, if they have any habits like smoking in bed that can cause detriment to their life, how much nicotine they've used, how long they've used it, what kinds of products they use. All of these things are very important when you're talking about counseling for the quality of the patient as well as the coverage and payment. So this decision tree is aimed to help the coders when they're defining these tricky situations. There's a lot of codes at play and a lot of different questions to be asked. So let's run through this kind of quick. So first off, does the patient use nicotine? Let's say they say no. No, but I've been exposed to secondhand smoke. So in this column, you'll see some of the options that you could choose from as a coder to make the final selection based on the documentation from the provider. So what if they weren't exposed to secondhand smoke? No, I used to smoke, but I don't smoke anymore. So how long did you smoke before? And is there a reason or a clinical relationship to the reason that I'm treating you in the office today to that smoking history? That should be something that is asked and documented in the record. That relationship or that linkage to a condition or underlying etiology of something else, a cause and effect relationship, really needs to make it into the counseling note. Let's say that the patient says, yes, I used to be a former smoker and now I've got this cough that won't go away and COPD. In that case, you would use the history code for the smoking as well as the condition code for the COPD. So let's go to the far edge here. Does the patient use nicotine? Yes. Is the patient pregnant? If the patient is pregnant, then you follow this path because they're always in an assignment from the category of pregnancy, 0 or O, starting 099.33, and then the final characters depending on the situation and documentation by your provider, as well as the smoking. And you would need to know at what point what type of product that they used, if this is the case when they're pregnant. So if you're not pregnant, you follow the same pathway. Do you have a dependence on nicotine would be the next question that you would ask of the patient or look for in the document as you're trying to assign the final diagnosis code. So this is the next slide in the decision tree. So you see it's continued here. Yes, I do have a dependence. Yes, what kind of dependence? Is it cigarettes? Is it chewing tobacco? Is it e-cigs? Is it unknown? So this is important because if you're providing smoking cessation counseling and you're using an unknown diagnosis, I don't think that that looks like you did a very good job to the payer. It would be unlikely that they would not request records or simply deny it for unspecified diagnosis. So this is really important details to the final code assignment and showing the acuity of the patient, the severity, and the nature of the counseling. Now remember, many of these services are provided in conjunction with E&M services. So your patient is there for an evaluation and management of COPD or emphysema, and you're also going to provide them with smoking cessation counseling. So here I provide two examples for us to talk about. I have not written the E&M portion on this slide just because this session focuses on the cessation billing requirements and elements. There is a separate session that talks about the evaluation and management portion. So if we'll look at this first example, this is the patient admits to nicotine dependence for 20 years. He describes the habit as disruptive. He smokes a full pack a day. He presents with a nicotine-induced emphysema. Good job to the physician that documented that linkage there. So now it gives us an acuity, a more severe reason to cease smoking and follow more closely. So he documents he spent 10 minutes of smoking cessation, and he's given him a referral to attend the American Cancer Society Group Support Center, as well as Nicorette gum, and a quit journal to describe his journey along his abstinence. So in this case, you would likely be able to bill $99407 for the 10 minutes of cessation spent in counseling, and with a diagnosis of F17.214 to describe his nicotine dependence on cigarettes, as well as the E&M service that would have been provided to deal with the emphysema that was induced from the nicotine history. Now, Medicare will pay for smoking cessation services up to 8 times a year or 8 times every 12 months. So they pay roughly $15 depending on your geographic area, $15 for the 3 to 10 minute code, and roughly $26 to $30 for the 10 minutes or greater code, 99407. So you could improve your bottom line as a physician and improve your patient's outcome and quality of health by doing a smoking cessation risk assessment with every E&M evaluation encounter. And just because you're doing a risk assessment doesn't mean you're providing the counseling. So you wouldn't necessarily render cessation services on every encounter, but you would want to make a risk assessment and qualify if the patient required cessation or had a habit in which required any other lifestyle counseling. So here's the example on the other side of the page, that there is no codes assigned because there's no record of time spent. And remember, if there isn't any recorded time, then you are not able to bill for the service. As well, the physician did not do a good job of linking the condition to the nicotine or qualifying the smoking history or status. So in this case, this provider lost out on at least $15, perhaps more. That adds up if you consider the patient flow of how many patients and how many evaluation and management services you do in every day. Well, there's my food for thought and the resources I used to make this session. I hope you've enjoyed it as much as I have, and I look forward to next time, next week. Until then, have a great night. and goodbye.